Hi all, myself Dr. R. Rajakrishnan, MPT Neuro. I am working as an assistant professor at SNS College of Physiotherapy. In this video, we are going to see about what is contrast bath. We all know that the contrast bath comes under the electrotherapy too in MGR University syllabus. But in this contrast bath, we are going to see what are the therapeutical effects, how can we apply for that, like is in the PT part also. So we can use it for PT and also for your electrotherapy part. In this contrast path video, we are going to see about what are the principles, what are the physiological processes undergoing during the contrast bath, what are the indication contraindications, and how can we use it. Going to the topic, Going into the topic, contrast bath is a therapeutic modality widely employed in physiotherapy, characterized by alternating immersion of a body part, typically into hot and cold water baths. Likewise, we are having it. We just imagine we are having two utensils. One is having hot water, and another one is having a cold water. First, we are going to immerse in hot water or either in a cold water. This dynamic temperature change is strategically utilized to achieve several therapeutic goals, primarily to enhance localized blood flow and effectively reduce both pain and stiffness within the affected area. So, in this contrast bath, we only use it for uh, lower body immersion, lower part of the maybe foot or maybe your hand. We can be used for these extreme distal extremities only. This technique is particularly effective for treating conditions affecting distal extremities such as hands, feet, wrist, and ankles, where circulation can often be compromised or inflammation localized. For alternating immersion, the core of the treatment involves rhythmic switching between hot and cold water. Targeted application, I already said that more commonly for the distal limbs. Locally, it can be used for localized issues only. Then the therapeutic goal is to increase the blood flow and migrate discomfort and rigidity. Otherwise, we are also using it for to reducing the pain. In this picture, this shows that the distal part of body is the distal part of the body is immersed in the hot water. Then the main therapeutic effect is the main principle of this contrast bath is the vascular pumping effect. It gives the vascular pumping effect while we are immersing the distal parts of the body. So the hard part here immersion promotes vasodilation that so that the localized blood flow will increase and the metabolic activity will increase. So it gives a vascular pumping effect. The therapeutic efficacy of contrast bath stems from a profound physiological principle, the alternating cycles of vasodilation and vasoconstriction. When the affected limb is immersed in hot water, blood vessels dilate. So that is called as vasodilation. It then increases the blood flow to the particular area. Conversely, immersion in cold water causes blood vessels to constrict. Then it goes for vasoconstriction, which reducing the blood flow. First we will give a hot water immersion, then we will give a cold water immersion so that the vascular pumping effect will get increased and edema and pain gets reduced. In particularly while giving hot water immersion, it promotes vasodilation. While giving cold water immersion, it gives vasoconstriction, which reduces the blood flow. The metabolic rate will also reduce. It minimizes the inflammation. Then the vascular pumping. The rapid alteration creates the pumping action, enhancing overall circulation. So the overall circulation is increased. So the edema and pain is getting reduced, which facilitates the removal of swelling, reduces nerve sensitivity, alleviating pain and stiffness. The rapid alteration creates a vascular pumping effect. to a natural circulatory pump. This enhanced circulation not only brings oxygen and nutrients to the injured tissue but also actively facilitates the removal of metabolic waste, products, and edema. Through improved venous and lymphatic drainage, this mechanism contributes significantly to the reduction of pain, stiffness, and localized inflammation. In the next video, we will see what are the remaining parts of this contrast bath. Thank you.